Okay. Yes, sir.
Wondering, um, do we have a intention here to have a new law that will ban heated products? Do you intend to do that? Do you intend to ask Congress to
Yes.
ban vapes and all of that? Because I think doctor the findings of the doctor kanina are correct eh. I'm actually a
Vicky,
And
you're not a
what
good.
what she said was actually correct, because this one, in one puff, I consume three like this. So you need this one, right? So it's actually correct. Eh? So
Do,
if you want to ban it, I think there's sufficient time, probably in the 20th Congress.
do
But
we?
I'm more concerned about the enforcement.
Yes. Do
Because
we?
in Hong Kong and in Japan, well, in Hong Kong, vapes are wala na eh, di ba? But there's designated smoking areas. So do you intend to propose that thing so that because that's actually one form of enforcement and limitation. So do you intend to propose that in the 20th Congress?
Audio.
We have been lobbying for that since 2017. Um, what is actually hard is e-cigarettes or vapes
Mm.
does not have tobacco product. They have nicotine. It has been replaced by flavorings and humectants, the propylene glycol and the vegetable glycerin to create the smoke using the heating device. But it's actually marketed as harm reduction. But for children, it's not harm reduction. What did they say? The WHO survey, these new vapors are children, so they are harm introduction for children. Now, with heated tobacco products, the name itself, it's still tobacco. We have the Tobacco Control Act of
Yes, yes, yes,
2004,
correct.
so it should be there.
Mm.
It should be there. So no matter they say it is micronized, it doesn't use combustion,
Oh.
it's still tobacco.
Because there's less smoke there eh,
Yeah.
in the
Yeah.
HTP.
I asked one of those vapors and the smokers, what is in there in cigarette or in vaping that you really hunt? Humans are actually basically want something pleasurable, the hand to mouth.
Mm.
So the vaping, hand to mouth, heated tobacco product, hand to mouth. Children who loves to experiment with devices. So vapes, heated tobacco. You know what? Before that heated tobacco product is just like as big as the iPhone. Now, it is so small, it is colorful, and they put flavors. So whom are they
So it's not
marketing?
the smoke. Kasi
The
sabi nila,
children.
yung mga vapors daw, kaya nagano sila because of the smoke.
Usually,
Usually.
is the pleasure of putting into the
So
mouth.
doctor, any tips for me?
Uh,
The reason why I nagpunta ako dito because I really want to lessen
yes, but
my consumption.
the role of tobacco control is to quit, not to shift,
Not to shift.
not to shift. So that should
Pero
be your
yung
step
cold
down.
turkey kasi, si
And
Attorney T,
then-
sinabi sa akin yan eh.
Yeah, that should be a
Yung-
step down. And for tobacco cessation, we're just giving you 3 months to do that. There is actually a shortcut. Delay if you have the urge. You drink water if you have those dry throat and all. You distract yourself, do other things.
Mm.
Now, if you can't do that, pray. Divine intervention. And we have the DOH.
Kasi
quick
though they
line.
say that after a month or two, pero hindi eh. I've been
It's
using this
actually you
years.
should be coached by a tobacco cessation specialist
O yun,
to guide
that's
you.
the third point
guide
sana.
you. And
Magkaroon
we
kayo
have
ng
that.
hotline.
Yeah.
And you promote the hotline.
And
Kasi
then,
I'm sure marami sa amin ang
and the
they
marketing
really
will
want to
always be
quit.
your trap to try on.
Oo. Except that na-influensyahan na ako ni Dodi eh. Thank you very much.
Opo.
You know, sometimes we need to get sick pa, no? We need to get sick pa so we will stop smoking. I know somebody who's chain smoker.
Actually,
and
being sick is one of the number one factor why they stop, especially TB.
right. And
If
cancer.
you say that they have that, they will really
Stop. But it could be late.
Yeah.
Too late.
And for children, I want to add info to what Doctor said. The secondhand smoke in itself carries more than 50% risk for children to have tuberculosis. What is the number one disease burden of our underprivileged, no? Tuberculosis. We always lack funds, or sometimes our very own population wants to tinatago kasi para bang ano ba yon, a curse pag nagkaroon ng TB. Well, in fact, it can be cured, no? Give meds and stop smoking. Create a healthier environment. That's what you don't know. Sabihin di naman naninigaril yung bata ba't ganon? It's the second-hand smoke. And for vaping, it's a second-hand aerosol.
So how far have we gone talking with the government or LGUs on the regulation? Do we have
We
any
have been
move on that?
talking since 2017. Do you know that even definition of term confuses? When I first appeared in one of those hearing, one of those legislators, I'm using this one. This one has helped me.
More
And
help?
he showed me, we're talking about vapes. He was showing me the heated tobacco product. Of course, I cannot say, that's wrong. I just have to say, after the recess, vapes are different from heated tobacco products. So it's still tobacco, whatever you say. And so we have to regulate. Ang mahirap kasi, we have laws. Actually, for a bill to become a law takes a lot of process. But we have LGUs to help us implement. Meron tayo, kahit sabihin mo pang flawed vape law, yun lang 100 meters restriction na walang vape, walang cigarette, walang heated tobacco product and alcohol. Hindi nga magawa It should be peripheral, circumference. Akala nila hanggang dun lang. But we're trying to tell children, report it, your voice matters. Kasi it's you with the target.
Yeah.
It's so hard, but we are appealing to our press now. Let's correct the misconception. Let's put what our law has said. Merong regulation, but ang galing no? Walang implementation
Right.
and sustainability of implementation.
That's the sad part of this. Merong regulation but no implementation. Okay, a question from Miss Acosta.
Hi, I'm Lolly Acosta of DWIZ and Aliw TV Channel 23. I'm a smoker myself for like 39 years, and I had because I'm 68 now, so I'm free of smoke. So I had a polyp somewhere, but it was benign. But I guess Ricky should really stop it if you want to really prolong longer life with your family. But my question is for Dr. Brasnell. What does the latest independent research tell us about the health impacts of heated tobacco products?
Thank you. So we spoke a little bit earlier about my latest study looking at the clinical research, but beyond that, what we see is that when it comes to reducing disease risk and risk of death, that yes, it exposes you to lower levels of some chemicals, but actually when you look closer, it also has higher levels of some other chemicals, including chemicals that could hurt you and cause cancer, right? So that's not great. Then, as I've said, when it comes to the research on the health impact, that it's not yet conclusive. But the other things to consider, as I mentioned, were cessation. So as I said, they are not helping smokers quit. And if we want something to really reduce harm across the population, it needs to help smokers quit. And we're not seeing that with HTPs. And then, of course, youth. Across the world, the number of young people who are using heated tobacco products is increasing, which is, we shouldn't be we need to help smokers, but we can't sacrifice our children and lead them to addiction and a life of addiction and harm at the expense of these products. And then lastly, as I said, new harms. We're seeing new things. So people are going in with like forms of pneumonia from using heated tobacco products into hospitals. We're seeing, as I said, children who are eating the sticks. And these sticks, they actually have very sharp blades in them. It's part of how the device heats the tobacco. But those blades, when eaten, get stuck in your internal organs. And these children are like only 7 months old. They're very, very young, and they have to go through these horrific surgeries to try and remove the sticks. So it's possible that these newer products could be less harmful to a smoker. But that's not yet proven. And overall, across the whole population, we're probably going to see net harm. Because even if you help the 22% of smokers, even if all of them quit, if more children start using these products, overall, that's net harm. Does that make sense? Right? Yeah.
So you need us, the media, to promote this.
Yes.
Thank you.
Thank you.
Yes, good morning. I'm Grace Bernas of Birit Pilipinas News. My question is, do you think HTPs are part of genuine effort by the tobacco industry to phase out cigarettes or something else entirely?
I'll jump in again. So the tobacco industry claims that it is moving away from cigarettes and trying to sell these newer products. So e-cigarettes or vapes, heated tobacco products, and now we're also seeing these new nicotine pouches. But that's not true. The tobacco industry is continuing to sell cigarettes. It's not reducing on purpose the amount of cigarettes that it's selling. In fact, we're actually seeing that the reduction in cigarette smoking and cigarette sales is because of the hard work that everyone in this community is doing. It's because of tobacco control, not because of these newer products. And so really what the industry is doing is selling the problem and what they're calling the solution. So they get to make money off of you twice over. You're a smoker. Let's say you're a smoker for 20 years. They've made money off of you selling cigarettes. Then they say, oh, now try, you want to quit, we're so sorry. We're so sorry that you were really harmed, your health is harmed. Try our other product, which is more expensive sometimes, right? Like heated tobacco is quite expensive. But they're keeping you hooked on their products. And now they have this whole menu so that they can keep you on their products for life. They have nicotine, they're now into pharmaceuticals even. Some of the big tobacco industry are now selling drugs that are used to help treat smoking-related diseases. So they make money off of you in the beginning with cigarettes, then they switch you to another product, they make money off of you again, and then when you're trying to get better, they make money off of you again. So yeah, they're definitely not transforming the way that they say.
Okay, thank you, Ma'am.
I would like to add,
Yes.
that's why I don't want to use creating a smoke-free world. Because one of those big companies, which is marketing cigarettes and that of heated tobacco products, has the tagline, creating a smoke-free world. So they're playing with our psyche. So smoke-free. Kasi wala nang burning, wala nang combustion. So heating na lang, wala nang smoke. So I think we have to create a tobacco and nicotine-free world. Kasi pag sinabi, oh, we're creating smoke-free world, parang pinupush mo pa yung kanilang tagline.
And it's with the same danger.
Yeah, and the same big tobacco industry.